So this PowerPoint about the fundamental of nursing. Here we are going to focus about the patient teaching or client education, right? So when we dealing with the patient or when we educate the patient, when we teaching the patient or reinforce the patient, we have a goal or target, right? Like I want to transfer the information to the patient mind. So teaching is a goal driven or interactive procedure. Like I'm telling something, asking something, and get the feedback by them. So it is called both way is interaction. So teaching always will be interactive. It is good actually, effective way. Hmm? So keep in mind, client education or client education or teaching, it always involve the purposeful action to help the individual to acquire the knowledge about the disease. So I said our target to increase the knowledge about the patient disease. Like in this picture, think about this patient has a diabetic, but this patient if know how to control the diabetic, how to take the insulin, what are the sign and symptom of hypoglycemia, what are the sign and symptom of hyperglycemia, then this patient will be the doctor how to control his own diabetic. So this is the purpose of teaching. I said the real action to help the individuals acquiring the knowledge about their disease. So some terminology related to the patient teaching. So first of all, they said auditory learning process, health promotion. To be honest with you, the patient teaching or patient education or therapeutic communication, everything actually related to the health promotion. So the action related to way of becoming or staying healthy and promoting health. Auditory learning is the one of the way of teaching. What you are telling, they can listening you. So the learning is the intentional gain of a new information. Whatever it is auditory, it is visual or demonstrating. So our main target, intentional gain of a new information or attitude or a skill, and it promote the behavioral change. It promote the health. We called health promotion. Sometimes some learning by touch or doing, like you helping them how to do the motion exercise, how to do the yoga, right? And then tell them, can you show me how I do it? Then they do the demonstrate or remodeling. And when they repeat it, it's called reinforce. Or like doctor explain some surgical procedure and patient did not understand. And again you explain it, and this called reinforce, means to report anything. Visual learning, like I gave you the audio clipped, you watch it, you read it, and you learn. Visual. Wellness strategies, means action designed to promote the health practice. This is our goal, right? Even when you teach your patient, try to motivate them, influence them. Influence about what? Influence how much and how quickly a person learn. Also, the desire to learn and the ability to learn or understand the content or of affected motivation. So I said sometime all of this, like auditory, like visual, so all of this not only health promotioning, it is also part of information technology. Hmm? Because we use so many device also, like visual, auditory. So now here showing next page, learning style, visual learner, auditory learner, another is the touching or doing. So I said some student even they feel comfortable to watch the 3D dimension. They they prefer to learn so through a video visual. They like to direct or active participation, right? And some are like auditory, like I'm sharing the information. Some of the student, you can read it at home, this PowerPoint, but still you want to hearing. So they feel good. That's it. Hearing and learning, right? And somebody like to participate, active participate in the procedure, and they learn. So whatever it is, then always the nurses provide the health education to individual or families or communities, either visual way or auditory way or participate or demonstration way. So keep in mind some of the factor always influence the teaching, right? It is coming here, the factor affecting learning, but before here it said addressing the patient learning style. People learn in every style. Most prefer one style. Maybe you like visual, others like auditory, others like participate. So address each style to learn what they like, go and continue. Either visual, written, videography, or participate, remodeling, or demonstration. Next, what are the factors affecting our learning? Like environmental, comfort, readiness, language, and sense. Environment, like I'm teaching in the classroom, I'm teaching through the Zoom online. So it definitely influence the factor. We can't teaching in the highway. There's so many traffic noise, right? So environment is a factor. Comfortness, like my patient not feel comfortness with me, they will not share their story. If you not comfortable with me, you do not ask me the question. It is my fault. I'm not making you easy to ask me question. So readiness, language. So if you do not understand my language, how can I convey the information? How I will print the information in your brain? So if you and me talk in the same language, same understanding level, it is easy to carry the information. Even I'm talking with 50 students, out of 50, every student will not get me in the same level, right? So it is the receiving or accepting the information always depends on the individual, also the sense. So I'm telling you some of the factor influencing the client's education or educational needs are health or educational level, socio-economical status, and even culture and family influences. Like a patient you are dealing, he or she had a high education in the health science. It is easy to educate them. If a patient is totally no education at all, it would be difficult to convey the information. If my culture and your culture is the same, it is easy to convey the information about the health. So as a RN, as a LPN, you have to learn the world culture about different peoples and different cultures. Even socio-economical status or family influence the patient or people's learning system. Hmm? So guideline for arranging for an interpreter. If the patient do not understand the language, we will provide a licensed interpreter. But before to go here, I can tell you, so here they said, arrange for an interpreter who speak the patient primary language. Like you dealing with a patient do not understand your language, but patient said, I don't understand, but my children, or daughter or boy can understand. He can transfer the your language. We will not allow. We always call the hospital licensed interpreter. Use a professional interpreter instead of family. Arrange for an interpreter who has some understanding of medical terminology. Try to avoid using young children as an interpreter for the parents. So, what is the purpose of patient education or teaching or re education or reinforcement? Instruct the patient on health promotion and wellness strategies. Explain the disease process, treatment, and care. Hmm? So now let me tell you something before to go next level. So when you educate the client, even emotional status or spiritual factor or health perception, willingness, and developmental level are also very important to consider when providing the client education. So client education provide the client with information and skill about or to maintain and promote the health and prevent the illness. So you see, instruct the patient on health promotion and willingness. I said maintain. So why I'm teaching my patient? Why I'm teaching about the asthma control if patient have asthma, or diabetic patient to control diabetic, or atherosclerotic patient to control atherosclerosis. to maintain and promote their health and prevent the illness. If they know how to control the cholesterol, they prevent the heart failure. If they know how to control hypertension, they can prevent the congestive heart failure. Also restore the health, like self-administration of insulin or adaptation or adapt to permanent illness or injury. Like if patient need ostomy care, swallow techniques or speech therapy, everything adapt to permanent illness to injuries. Next here. So what next? So now here, example of patient teaching continue health promotion like regular exercise, proper nutrition. So if patient is under nutrition, kwashiorkor marasmus, if they take good quality and good quantity food, they can overcome the malnutrition. If you are obese, if you do regular exercise, if you are diabetic, high cholesterol, you can prevent your disease. Willingness, like stopping smoking can cause the cancer. If you know how to stop it, if you really do this, you can prevent so many diseases: lung cancer, heart disease, peripheral vascular disease. If you are over alcoholic, stop it. It is also bad. Losing the weight, reduce the obesity. Obesity is a cause of so many diseases or disease process, like teaching about insulin, teaching about how to control hypertension, ultimately prevent the major diseases. Now here talking the teachable moment. Hmm? So first of all, patient asks about the illness and treatment. The nurse see an incorrect procedure and giving the correct information. The nurse point out a connection of a cause and affect the patient, right? Example of teachable moment like bathing or personal care, daily weight, ambulation, meal, toileting, treatment and medication administration. Hmm? So I said teachable moment. Yeah, it is important. If we know, sometimes we categorize the teaching is called cognitive learning, or sometimes called affective learning, or psychomotor learning. So cognitive learning means, like, if patient, yeah, it is cognitive learning means you use patient IQ, means require the intellectual behavior or focus on thinking. It is involved the knowledge, comprehensiveness, application, analysis. Why I'm talking about this? Like if your patient have a arteriosclerosis or atherosclerosis, if your patient is already have enough education about this, it would be easy for them to prediction about the atherosclerosis future. Then they can stop, they can modification their lifestyle, right? They can stop rich food, drink alcohol, stop the smoking, all the time eat the rich food, and they can prevent it, right? So the nurse point out the connection of cause and effect of the patient. So if my father had a high blood pressure, if my parents, if uncle have a high blood pressure, I have a chance to develop high blood pressure as well. So what I could do, I have to do physical exercise, avoid the sedentary activities, avoid the too much salt, and regular checkup. So it is called the connection. So when you take the my family history, my past medical history, then you have to coordinate and find out the prediction and stop me do this, do that. So some example, when you deal with the patient, in which area you can teach them, like personal grooming, very important, right? Their food habit, importance of nutritious foods, about the talking about the bathing, daily body weight maintain or measurement, avoid the obesity, and patient need ambulation movement. Like when they do the movement, their GI movement as well, and their defecation will be good. And importance of appropriate meal in the same time, same day, good amount with good nutrition. Toileting. If the patient has a elderly, if they every 2 hour go for the urine, so they can avoid the urgency, hesitancy, or frequency. When they reduce the urgency, they can reduce the chance of falling. So toilet training is important. Even the children, treatment option, or the right time, right medication. Before eat insulin. If patient has a gastric ulcer and they has to take the proton pump inhibitor 30 minutes before take it. If patient want to take antacid, tell them take it after food. If patient need to take iron for iron deficiency anemia, tell them to take with vitamin C, avoid the milk and milk product. So we could teach them about the treatment or medication. Also, medication administration. If it is anything sublingually, tell them to take sublingually. If anything, take to anything need to take in IV or sub-Q, tell them to take or follow the right route. So when nitroglycerin we took sublingual, then it would be easily can work, rapidly work. It can avoid the fast metabolism. It's very important. Educate your patient. Tell them do not keep the medication on direct sun contact, right? Next here, developing a teaching plan based on nursing process. So nursing process have a 5 steps. One is called assessment, nursing diagnosis, planning, implementation, evaluation, and finally documentation. But here we are going to discuss how to teach the patient during the nursing process. The first one is the assessment. Identify the patient learning needs. assess the patient readiness to learn. So, like I have a bronchial asthma, and if you teach me about the diabetic, it is okay. You can tell me about the diabetic, but it is not my need. Like I need to learn how to control or how to prevent bronchial asthma, and you teach me about the politics. Or I said, you teach me any other disease, but I said you have to find out what your patient need to learn, then assess the patient readiness to learn. So first of all, assessment, or we called data collection. How we can make assessment? Collecting data, right? Monitor the learning needs, then evaluate the learning environment, or identify learning style. You can talk to me and you can ask me which one you prefer, audio, visual, or participate in demonstration. So you can find out or identify the area of concern. What does it mean? What is the level of my education? If you see your patient is totally no education, if you see your patient is a higher educated, definitely the way of teaching will be changed. So I said we could identify the area of concern, like if the low education level or if patient is distracted easily, their education system will be different. Or identify the developmental level, identify the developmental level, or even the we can determine the physical or cognitive abilities, or we can assessment or identify specific needs. What does it mean? Specific need means if your patient is a visual impairment, definitely you do not tell them, okay, go and see this videography. If your patient do not know how to read, you can't say, okay, go and read this literature. So learning challenge it is, and we find out why my patient needs, what are the tools, what are the learning style they need. And also I said always we could determine motivation and readiness to learn. Second point is nursing diagnosis. It's called deficient knowledge with description, readiness for improving the knowledge and description as well. So here we go, the nursing diagnosis. So definitely after assessment, we can find it out what are the problem, educate them, and try to improve their knowledge level, means how to control their disease. And definitely you have to explain, if you do not control, this is the bad or outcome. Like a patient has a developed the Barger disease or gangrene in the uh, grade 2 or feet. If they do not care about it, they need to amputation their legs. When you explain what are the future output, they can be concerned about the care of them. Third is planning. So decide how to teach, about their problem or their needs. Planning is very important about the nursing, teaching way of nursing process. So always we identify mutually agreeable outcome. Example, I'm teaching you through the Zoom. If you are not agree, if you say no, I need in-person participate with you. So you agree and I am agree and we are continue. So when you deal with the patient, you can find out the needs, find out which tools or learning style they feel comfortable and go forward. So identify the mutual agreeable outcome or prioritizing the learning objectives with the client's need in mind. As I told before, if I have asthma, you have to educate me how to control the asthma. If another patient is diabetic, you educate him or her how to control the diabetes. So prioritization of learning. Also, we use some method that emphasizing the learning style. Hmm? Even in this planning time, we can find out or we can select the patient age group. Hmm? To select age appropriate teaching method and materials. Like a children, if you play with them during the teaching, if you bear carry a teddy bear during the teaching, it would be easy for them to receive the information. But you can't do it with the adult person. Always we speak and provide the print materials if patient need. Hmm? So I said, um, when we talk to the patient, we can find out and also we can find out the resources here. And now implementation. Present the information with teaching plan. So implementation during these steps, we create an environment that promote the learning. Hmm? Or use the therapeutic communication to develop the trust and promote the sharing of consent. Or we review the previous knowledge and experience if the patient is already came in the same center more than 2 or 3 times. We can review what they did before. Or we explain the therapeutic regimen or procedure during implementation. Like you can tell, okay, you have a, or if you like, you can read the journal. If you like, you can take the DVD or CD, or you can go in YouTube and check it. Like you can give them the link. So I said we explain the therapeutic regimen or procedure. Hmm? Or sometimes we can decide some demonstrate or psychomotor skill or allow the time for return of demonstration. Also provide a positive reinforcement. Then go for evaluate. Determine if the patient has learned the information. So we ask the client to explain the information in that own words or observe the return of demonstration, or we use the written tools to measure the accurate information, or we can ask the client to evaluate their own progress. or observe non-verbal communication. Hmm? And whatever everything finally we can keep in documentation. We are talking here the teaching on based of nursing process. Next here, the resources of the patient teaching handout like associate and foundation, health department, and patient education website. So if the patient has diagnosed with Alzheimer's disease, we give them some resources, information about the Alzheimer Foundation, some social worker contact address, or if patient has a communicable disease, you tell them to contact with the local communicable disease and prevention center or CDC. Patient education website. There are so many websites right now in the internet. We can give them information so they can find it out. So always use the reliable internet source or to access the information and support services. Hmm? Like next here, teaching with children's. If the children use age appropriate information, use a doll or teddy bear as a patient, then educate them. Allow the client to perform the treatment on doll or teddy bear. Always tell the truth about whatever the treatment will be uncomfortable or comfortable. Tell the truth. Make them smarter. Sooner or later, your baby have to face all difficulties. So why not you tell today? So make the advantage of opportunities to speak at the school and daycare center. But when you teach your children, better to use small sentence, clear sentence, hmm, in what they can easily understand. Teaching the elder client. Have the caretaker or family present, have the caretaker. So it is good. Don't abuse your client. Better to be somebody there. Allow plenty of time because they are slow. They need time to organize. Then they go for verbalization. Be altered to clues that the patient does not understand. So if they do not understand forgetfulness, so many complication, you give them some clue, they can catch it up and go forward. Be patient, hmm, and use plenty of repetition. Sometimes they do not understand you, but they do not catch you. So you can repeatedly, slowly, gently, don't be angry. Hmm? And again, we give them simple, straightforward, purposeful direction or very clear question for teaching. Evaluating the patient teaching. So have the patient restate what is tough and ask the question to determine the patient understanding. Ask the patient to give a return demonstration. So sometime when you interact with the patient, they does not feel comfortable to share the information. So you have to find out what are the factors affecting the learning. Hmm? Like if your patient are anxiety or under depression, or if the patient has physical discomfort, pain, fatigue, environmental destruction, or health or cultural belief, so definitely it is not easy for them to catch the information from you. So we have to find out what are the barrier or factor affecting the learning. Hmm? Also, encouraging the patient for active participation, or aids an education level appropriate method of education. Here's some information talking about the information about the internet. Hmm? How we have to guide our patient. This said guideline for searching internet information. Explain the preferred site for healthcare information. Tell the patient to avoid reading blogs about the disease. Tell the patient to avoid. You see why? The problem, if you know everything, it is good. If you do not know, or if you know little bit, this make a problem. And when you read something, already patient is a disease, they can catch the bad things first. If disease is bad, the patient who diagnosed by the terminal illness, when they read, they can easily catch up the bad things, but they do not know the end of the tunnel. There are light we call hope, and they will not catch it up because they are not master in that information. Encouraging the patient to use the family site that contain accurate information. Hmm? So sometime I said we use the reliable internet sources to access the information and support the services. Hmm? So incorporate active participate in the learning process, or schedule teaching session at optimal time for learning also important. Explain the author credentialities and educational background should be listed in the internet. Explain that commercial website selling the product are not reliable. They're doing the business. And give the alternate to the internet for information. What are the alternate? Provide some electronic educational resources like CD, DVD, software program, or mobile application. There's so many apps right now. We can use it. It's an alternative, right? Here talking about the last page, this PowerPoint, information connection feature. So I said we have enough, when you go to the school, you have enough knowledge in anatomy, physiology, and when you start the clinical or work in the hospital, you get so many clinical experience. And when you put all of this together, it is called clinical connection. By this, you can go for assessment the patient, then go for diagnosis the patient, then go for planning. And when you talk to the healthcare provider, go for intervention and evaluate. So everything we will do in relation to realities. Hmm? We have communicate with the other professional in the same field, or we can work under someone supervision, or someone can work under our supervision. Maybe someone delegate me for the patient, or I will delegate someone for the patient. It is the teamwork when we work in the hospital. But our target, purpose, patient focus, patient centered. When we implement the intervention, maybe patient is becoming good or okay. Make them ready to discharge from the hospital, make the bed empty for new patient. If patient condition gets to worse, change the treatment plan, call the specialized doctor. Everything we do by a meeting or conference, right? So that is enough for patient teaching.